Good morning. Dr. Brent Roussin here, Manitoba's Chief Provincial Public Health Officer. The total number of lab confirmed positive and presumptive positive cases in Manitoba is at 15 at this time. Those include the 7 new presumptive positive cases that were reported in the evening yesterday. Public health investigations are continuing on those 7 additional cases that were identified yesterday. 6 of the 7 cases we can report right now were travel related, and we're pending information on the 7th. Our social distancing messaging continues, and this is going to be one of our most important strategies to limit the impact of this virus in our communities. And so this is not the time to be going out to crowded bars or to restaurants. Now is the time to ensure we're distancing ourselves from others, avoiding the close, prolonged contact with others, and staying home when we can. This is essentially important to those at high risk of developing severe complications of COVID-19, including those over 65, those with underlying medical conditions, and those with immune compromise. Certain things that I want to stress about the social distancing is that this does still apply to inviting groups over to your home, play dates for your children. We want to ensure we're maintaining that social distancing at this point. This also includes faith-based gatherings. I want to stress that social distancing should not mean social isolation. We need to ensure we're reaching out to our vulnerable groups, ensuring we're reaching out and connecting with our neighbors and our vulnerable populations. Social distancing is very important right now, but we have to ensure we're not leaving people feeling isolated at this time. Reach out, help out, and ensure we're all working together. Once again, I'm stressing the importance of canceling or postponing all international travel. We can see that the vast majority of cases in Canada are travel related, and we see rapid developments in other areas of the world. More and more travel restrictions getting put in place all the time. Now is not the time to travel outside of Canada. Please cancel or postpone any travel plans outside of Canada. All returning international travelers must self-isolate for 14 days upon their return to Canada. We know that the large proportion of cases are from international travel, so we're advising all returning international travelers to self-isolate for 14 days, monitor for symptoms, call HealthLink should you develop any symptoms. This also includes returning healthcare workers from international travel. Now, of course, we need to balance capacity and protection. So healthcare workers that are deemed to be essential, meaning that they're required to continue the operation of a certain area, we have risk assessments in place and may be able to return given certain precautions, daily temperature monitoring, wearing a mask. But all returning healthcare workers from international travel must report this to their occupational health person at their employer. I want to talk about testing again, and again give the recognition to the CADM Provincial Lab at the amazing job they've done to increase testing capacity in such a short amount of time. We know that from other parts of the world, testing is vital to identify early cases and have them self-isolating as soon as we can. Yesterday, CADM Lab ran 544 tests for COVID-19, giving us over 2,900 cases to date. We have no further positive results to report. It's important that these tests are reserved for people that need the testing. So again, I stress, people without symptoms do not need to be tested for COVID-19. So that's a message to both individuals who are concerned and to healthcare providers. Please do not ask for testing for COVID-19 if you have no symptoms, and healthcare providers should not be submitting samples for individuals without symptoms. All international travelers with symptoms of respiratory illness, fever, cough, other respiratory symptoms, we do want you to call HealthLinks and be assessed for the need for testing. But I want to make this clear is that we do not have the ability to test everyone with mild respiratory symptoms. If you have mild respiratory symptoms but have not traveled recently, stay home when you're sick and isolate when you're sick. And that would be doing your part. We cannot test people with mild symptoms who have not traveled or have been in contact with the illness. I understand that Canadian Blood Services has expressed concern over a recent spike in appointment cancellations, and we do know that the need for blood does not go away during a pandemic. Donating blood is safe at this time, and so I'd encourage everyone who is willing and able to really consider that. I know many Manitobans continue to be worried about COVID-19. But like I said, fear is also contagious. There is no need for panic or fear buying. There's no need to stockpile on food or other products. Canada has a very strong supply chain that's not going away. Have provisions for the week or two, but there's no need to stockpile at this point. Remember, we talk about roles everyone has as an individual, those social distancing roles, washing your hands frequently, coughing and sneezing into your sleeve, staying home when you're sick. This is another role. There is no need for panicked buying and stockpiling. It just leads to contagious fear, which will not help us with COVID-19 at this time. We want to remind you that our healthcare system has been standing at its highest level of preparedness since the beginning of February. We work with partners in all of the regions, including our Indigenous partners, and we have been preparing for this very circumstance that we're seeing now with cases being introduced into our province. We're responding by increasing our testing. We are doing public health investigations of the cases and the contacts. We've implemented many social distancing strategies right now that are going to have a large impact on reducing this virus's impact in Manitoba if we all play our role. Our preparedness and our use of credible information is what's most vital right now. I want to warn against the spread of misinformation. Please go to Government Manitoba website on coronavirus. A lot of information there for all individuals, the public, healthcare workers, employers. So please use credible information when making your decisions. And now is the time for action. If you haven't changed aspects of the way you live your day-to-day life, you're not thinking about your role you can play to protect yourself, the people around you, and our province at large. Now is the time to implement those social distancing strategies. We will be able to get back to our normal day-to-day living. But right now, we need Manitobans to focus on what they can do to limit the spread of this virus in our communities. And so we're here to provide credible information. I see many Manitobans stepping up in many aspects, doing their part to limit the spread of this virus. It's much appreciated, and thank you to all, and we'll keep everyone informed, and we're doing our best to protect Manitobans from this infection. Thank you.
So I'm Lynette Siragusa from Shared Health. I am the Provincial Lead for Health System Integration and Quality, as well as the Chief Nursing Officer. So I would like to just start today, keeping with the theme of Dr. Roussin, acknowledging the members of the public who are changing the way they live, but also stepping up. And I just wanted to say, after yesterday's conference, we had an incredible amount of people call to donate blood, and they wanted to express their thanks to all of Manitobans who stepped up to that, as well as continue to encourage people that if they are able to call them, and they're very happy to facilitate that. We're not in a crisis situation yet, but the supplies are getting low, so that's a proactive approach. And I also want to acknowledge the public in a different way. I was hearing a story yesterday about an access center who was so busy. They had over 200 people come in for COVID-19 screening, and at the end of the day, they were pretty tired and did their work, but were exhausted. And the patients who were in the waiting room with their surgical masks got up and gave them a standing ovation. And, it's a very disruptive time, and there's a lot of uncertainty, but the one thing that keeps us going is just being certain of each other, that we're all going to contribute in whatever way we can. We're going to remember that to say thank you and acknowledge good deeds, and those patients standing up and giving a standing ovation to the staff, I think, was really appreciated and so well received. So I just want to acknowledge that and say thank you to the public for hanging in there and staying with us. We're just beginning this journey, but these are lessons we have to carry with us throughout. I wanted to also just provide you with an update, just a rundown on the data. So more than 2,100 patients now have been screened for COVID-19 at the designated testing sites. So that's Winnipeg, Thompson, Flin Flon, and the Pas in the past 6 days. Yesterday, 430 patients were screened. A new dedicated testing site has opened this morning at Brandon Regional Health Center in the nursing residence gym. Hours will be 8 a.m. to 4 p.m. 7 days a week. A reminder that these dedicated testing sites are not walk-in clinics. Manitobans are asked to call Health Links, who will be able to assess whether COVID-19 is required, testing is required. We anticipate more sites will open tomorrow and until the end of the week, and we will update you on that as it happens. Health Links yesterday received nearly 2,100 calls. The average time was 2 hours and 4 minutes. The interactive voice response is hopefully being added to Health Links today, which should shorten the length of calls. Digital Health has made some technical improvements to the online assessment tool, which we just recently launched to better handle the web traffic. The screening tool has received nearly 91,000 hits as of yesterday, and even this morning, we had 17,000 at 10 a.m. So we continue to encourage Manitobans to use the tool, and it can be found at www.gov.mb.ca/COVID-19. Occupational health nurses, so staff and physicians with an international travel history, are required to contact occupational health immediately upon their return. We want staff to stay at home after travel for 2 weeks, as as Dr. Roussin has advised. But there are some staff who are essential services that perhaps are one and only, or one of a very small group. So we are looking at a process for those people who are difficult to replace, and what kind of safety precautions we need to put in place for those staff. I also want to announce that breast screening will be on hold for 2 weeks through Cancer Care Manitoba. And then long-term care, just reinforcing yesterday that there have been some changes in visitors. They are restricting visitors. They are changing the way they deliver meals, so it's not going to be everybody all together. They're going to be looking at separating people, and so that they are practicing the social distancing that's been recommended. They're looking at alternative ways to deliver meals to vulnerable seniors. They are going to provide those options and put them in place within each regional health authority. And most of the work, over the last day is really the clinical specialists, clinical leaders working together on individual protocols for different areas of work. So as those are developed, I'm happy to share those with you, and we'll be sharing them provincially so that all Manitobans have the same standards of practice and consistency. So I think that's it for me, really.
What's the severity level of the 15 cases? Have any required hospitalization?
No reported hospitalizations. Everyone was recovering at home up to now.
Can you tell us how many people have been asked to self-isolate due to potential contact with any of these patients?
No, I don't have the numbers of contacts for each individual case with me here.
Can you just clear up something? Perhaps I misheard. 2,100 screened in the last few days, but total number of tests, did you say 29 or 2,100?
2,900 total tests.
What's the difference between those two numbers? Like, where's that?
So somebody might be screened but not appropriate for testing.
And that's just through the access centers that I'm giving you those numbers.
So 2,900 have been tested?
29
Yeah.
total tests at CADM Lab have been performed since we started testing. 2,900, yeah.
Off my head, that's a 0.6 tested to infected to a tested rate. Is that, what do you make of that rate in terms of how well we're doing right now?
Right now, that's telling me that we're still in the phase of active case finding, that we are actively searching out cases so that we can rapidly identify, isolate them, and then perform contact management. As that proportion moves up, then we're much more likely to be seeing community transmission, and then we move more to the mitigation phase.
Over 24 hours, that number jump almost by double. Is that something that we should expect to be seeing now as more people are tested, that those numbers are going to increase at a higher rate?
Well, we're going to see a variability on the testing results. So we'll see days that we had 0 positives and we can't make anything of that. And other days we'll see where we will have these number of cases. So it's really the nature of the tests, the contact investigations are important. So we're going to see more cases for sure, and we're very likely to start seeing community transmission as more and more of this virus is imported here.
How quickly do you anticipate that community transmission to be coming into that next step?
Really difficult to know. We can look at other jurisdictions, but there's many variables on there. And in addition, we've been out ahead of things, right? So we've our community-based transmission. Once we see that, that's typically when you move to social distancing strategies. We've had that in place now since day one of having even an imported case. So we'll have to just keep close watch on things.
What is the wait time, did you say, for health links is 2 hours and 4 minutes, or is that how long the calls are? Just to clarify there.
That is the wait time to get
How many
in.
people are you finding that are calling when maybe they shouldn't be calling?
Well, you know what, I think we need to set up some processes to make it easy for the public to know where to call. So there are people calling Health Links looking for lab results. So we would like to have a separate way for them to get that so they don't have to call Health Links. And there's other things mixed up with Health Links, as we talked about before. There's people with ear infections or stomach aches, and they're calling, and they should be calling. That's what we set Health Links up for. But we just have to build the capacity so that we can manage.
And is that being done? Like, are you working towards
Yes,
that?
we are. That's a high priority for us.
How long is it taking to get those test results back? We know obviously see hundreds of labs being done each day, but is it still the 24-hour turnaround?
So there's a couple different things in there. So at the lab, the turnaround on tests is roughly 24 hours, maybe a little bit more in certain circumstances. And then, of course, we act immediately on positive results. So how long that the negative results are getting called out, it's difficult to know that.
So, when will you be, or what's the plan for adding capacity to do more than about 400 tests a day?
There's a lot of things that go into that. So the lab itself has done an amazing job to be able to get to that level. If you look at our per capita testing compared to other places, we are amongst the leaders. But there are many other issues at play. The amount of swabs that are available, the amount of viral transport media that those swabs go into. So it's multifaceted. It's not just increasing capacity at the lab. So working on all that.
Have any healthcare workers, are they among the confirmed or presumptive cases?
Healthcare workers, I've not been informed of a healthcare worker yet.
Specifically respiratory therapists, any of them?
I've not been informed of that, no.
Are there, forgive me, are there any confirmed flu patients in hospital right now? Taking up any?
That doesn't get reported to me. We still see flu cases.
Do we know, like, how many ICU beds flu patients might be taking up, and generally, how is influenza affecting the COVID-19 response?
Yeah, I don't get the current reports of those. We have total numbers. We know the 26 deaths year to date on influenza. It's all on our report, but I don't get up to date day-to-day measures of who's in ICU.
In your opinion, should university students be sitting in classes taking exams today?
Well, I think it's the social distancing messaging, right? So I don't know the details on how they're trying to implement that, but to everyone it would be don't be in groups of greater than 50, maintain that distancing among individuals, and then look at how that applies. So moving forward, large groups of people should not be in the room together.
Dr. Roussin, we have city holding budget meetings. Well, it might not be 50 people in a room. They are in a small room for extended periods, shoulder to shoulder. Is this something that you would recommend not happening at this time?
So again, it's my messaging right now is broad, and so that a lot of people who make lots of decisions need to review my recommendations and see how they can implement that within there. So I don't know the specifics of that room size, how many people are on there, how they can maintain social distancing, but it's the messaging to everyone to constantly think about how you can maintain social distancing.
As far as social distancing goes with respect to neighbors, just to be clear, would you say it's okay for neighbors to kind of get together, or no, and just stick within kind of socializing within your own household?
Yeah, I mean, I think the messaging and it will be continue to evolve over time, but I think the messaging is right now is if the more distance you can have from other people, the better. So that doesn't mean you can't go check in on your neighbor and things like this, but I would advise against large groups of people coming over to your house.
What's your recommendation on acetaminophen versus anti-inflammatories? The WHO recommended using Tylenol instead, but we're hearing that there's no real evidence to support that. So what should people be taking or have around?
That's right, yeah. So this is really early on to comment on this. There's certain reports on that, so we're not going to make a broad announcement on that until we're sure on the evidence.
How many testing swabs does Manitoba have, and is that enough? There's been concerns expressed about a shortage in BC.
That's right. So we have enough at this point to maintain that current capacity. But you can see that there's days that our capacity is being very tested, and so we're working on obtaining more of those swabs. So this is what's vital about who gets tested.
Enough to maintain it for how long?
Right now, the upcoming weeks.
How many swabs are used per patient per test?
One.
This might seem like a silly question, but we are getting asked it in our newsroom. Are you recommending any closure or shorter hours or number of people at liquor stores?
Nothing specific at that venue from me. Of course, we have the whole of government approach right now. So all of government is looking at my recommendations and how that best suits their areas. And so that recommendation wouldn't specifically be from me right now.
Are you telling provincial and municipal employees generally to stay home?
It's I'm telling them the exact same thing that I'm telling everyone else, and then the all the government approach is stepping in to implement that as best they see fit.
We're often getting updates from you guys via a bulletin quite late in the afternoon, around 4:30, 5:30, kind of between there. Is that just because of when these test results are coming in, or can we expect to get those a little earlier in the day?
Correct. Those bulletins are going out usually within an hour of me being informed of those results, and so that's the best we can do.
How much more information are we going to get on cases related to travel? Because we're getting it every day of people saying, what are the exact flights, what rows, people super concerned.
Right, so as far as flights go, we have not seen documented or much documented transmission on flights. So we're not really going to be posting international flights anymore. And another reason to that is all international travelers should be self-isolating. So normally if we were in those 3 rows in front or behind a case, those would be the people we'd be contacting and say, you should self-isolate. Now, if you traveled internationally, you need to self-isolate.
Another big question we're getting is, what is your recommendation of people that are getting off those flights and need to get home? Many people getting in a cab. Is there a better way of doing this, or what's your recommendation?
Yeah, so again, it's part of that social distancing. So if you're certainly not on public crowded transport is not that the way to go. If you can be just one extra person in a car, then that's social distancing, and then usually for a relatively short period of time.
One question we're getting a lot is a little bit of frustration for when you describe a patient as being from Winnipeg or Southern Health Region, Interlake. They want a little bit more geographic information. Can you provide that? Will you be able to provide that ongoing?
Well, the issue is obviously we don't want to risk identifying an individual, and so it's always a balance. So we go with the health region, and we understand that our rural regions are quite geographically vast, so that doesn't necessarily tell people where it is. But the other aspect of that is that public health is doing extensive contact investigations. So anyone or at any place we felt was at risk, we're going to contact people and let the public know about that.
Would that have an opposite effect too? Like if you were to say, hey, this person in their 60s in the North End or whatever part of the city, would that not maybe incite more panic than?
Well, it's a balance. So we're going to do what we feel is the best way to protect the health of Manitobans. We constantly refer to using credible information, and so we do not want people to panic. We want people to be prepared and to use information. We committed to letting Manitobans know as soon as we knew about these cases, and that's what we do. So sometimes information is lacking as soon as we do, but we're also committed to protecting the privacy of individuals.
Will the online tune be available in French? Will it be available in French?
Yes, we're working on it being in French. In our conversations with French language services, they understand the need to get the information out and follow up with French as soon as possible. So that's on its way.
Do you know if pregnant women
are more vulnerable, or newborns are more vulnerable to infection?
Well, we see as far as children and very young, the vast underrepresented in cases, and including severe cases. Pregnant women certainly are more susceptible to things like the flu and other respiratory illnesses. So it's with this, it's very early. We don't fully know it, but it's certainly a known risk factor for influenza.
What are your average daily ICU occupancy rates right now?
I can check that for you. They are not as intense as they were when we were at our peak in the flu, which was December into January. But I can get back to you on that, Brittany.
Are any office staff working in any health regions or shared health also working from home? I mean, there is that recommendation from the federal government to work from home if you can.
If they're sick, they should not come to work, and if there's an option to work from home, then that would be fine. And we anticipate as the recommended changes with schools and daycares come, we're going to have to look at more options like that. But there could be, admin people.
Decision, it's not like the health regions or the shared health is saying, everyone, if we're gonna work from home, if you can.
Not that I'm aware of, as long as there's that social distancing in the office and people are able to come to work, we would encourage them to. But if there's other reasons why they can't, then we would make accommodations.
We're getting questions from people who want to know, why can't I wear a mask in work? I want to wear a mask. We're not getting masks. We're not supposed to wear masks. What can you say about masks and people who deal with the public?
So people who are ill and going to be assessed, we would put a mask on them because that protects the public from that spread. People who are in healthcare, who are with prolonged close contact and assessing people should wear appropriate personal protective equipment. In the general public, wearing a mask from on a person who is not showing symptoms has no benefit. So social distancing, frequent hand washing is the best way to protect yourself.
Are you going to be recommending specific shopping hours for seniors and at-risk people, like as a blanket policy?
Well, this is something that was mentioned yesterday and is in the works. I haven't, in my role, haven't specifically recommended that, but you know, like we've said here, is I've given these broad recommendations, and you can see that almost immediately Manitobans at every level have worked to help implement them.
Why not mandate it though? I mean, if it's a strong recommendation, why not go that extra step because we're trying to get ahead of this and stop that spread?
Yeah, and it's a good question with a lot of things we do in public health, and we almost always will start with the least coercive measures, and that is a strong recommendation, knowing that legislation is there to, if we need it, to make more of a mandate. Things like enforcement always come into play on how we would necessarily enforce that at a broad level. But we do have legislation that would allow me to mandate these things.
How difficult is it right now when people are coming back from international travel, and we've heard stories from people that are just not self-isolating because you can't really police that?
It is difficult. We certainly have no way of knowing who's coming back, and we would not have the capacity to follow up with each individual. And so it's that messaging. It's that, you know, we're in Manitobans. We all have that role to play. And if you are a returning international traveler, you know, one of the biggest roles you can play for all of Manitoba right now is to self-isolate, as we've been advising you. And so at the individual level, if we ever became aware of someone who was putting the health of the public at risk, then again, we have legislation to allow us to deal with that. But the message right now is, you know, we're all in this together. And if you're a return international traveler, it's vital that you self-isolate for these 14 days.
Do you think people are taking this seriously?
I think the vast majority of people are, and that's why we don't immediately go to coercive measures, is because most Manitobans listen to advice. Most Manitobans think of the people around them.
What's your advice to film production? We have reports of a film set with 90 extras in a room this morning. I know you've said 50, but what's your advice to the film production industry that's continuing on?
Yeah, my advice is exactly my advice to everyone. You should not be in gatherings greater than 50. You should be focused on social distancing right now, and you need to find a way to implement that.
Is there a time frame? I know that's a hard question to give, but if you're in a room of people more than 50, we've heard the recommendation of not being in close contact with people for longer than 15 minutes. What is kind of that time frame of 50 people in a room together?
Yeah, I mean, I think my advice is don't be in a room with 50 people. That's my advice. Yeah.
Doctors, forgive me, Ms. Sergers, we're getting some reports that when people are waiting on hold with health links in the morning, and then right before 8 a.m. they've been clicked off. Is there a bug that with a new shift that comes on or something? And if there is, can that be fixed? Are you aware of what I'm talking about?
I am aware, but I don't know the technical solution, but somebody smarter than me in that area is working on it.
Is there any plan to make drive-through, drive-up testing, screening?
Yeah, we hope to be able to share some information with you by the end of the week.
And the 2,900 tests, there have been 2,900 tests and 2,100 patients have been screened so far.
Those are those specific sites. And so they remember the screening is they're being assessed, and part of that is, do they require a test? So, yeah.
So the 2,900 tests, that's 800 more than are screened. Those are people who are tested in ICU or people?
Yeah, we're tested before we had those centers up, and people continue to be tested at other sites other than those specific ones.
Do you know how many people from ICU have been tested for COVID-19?
I don't know the number of that. I know that people in ICU with respiratory symptoms and a swab was submitted beginning 2 weeks ago, they were tested for COVID-19.
At what point would you recommend hospitals shutting down to visitors?
Well, right now we've made big recommendations and implementations of that. So certainly the long-term care facilities, we've done that. Hospitals, some have essentially done that. We've really limited it, and we're going to continue to to follow that.
Sorry, I thought that we were only at one visitor per patient. You're saying no?
Well, right now the recommendation here is from one visitor per patient.
But you know what, they're having those conversations at the operational table, so if that changes, and we expect at some point it will, we will report it back to you.
If this one case that you're not sure about if it's travel or not is a community transmission case, then what happens? Like, what's the next level of mitigation or measures that are taken?
Yeah, and so looking at this one case here, or when we see our first couple, we've actually put in place our mitigation strategy. Right, it's social distancing. So these strategies, we don't usually recommend the suspension of schools until we see sustained community transmission. We don't usually recommend social distancing strategies until we see sustained community transmission. So we've implemented those before. So if we start to see it, we are already in our mitigation stage.
So there's nothing left to do but a state of emergency? Or?
It would be a heightening of the social distancing strategies.
We are getting questions from people about, okay, I live at home and somebody, parent, relative, is returning from travel and self-isolating at home. What do people who live with people who've returned home, what should they do?
Right, so people who are self-isolating and are not symptomatic can be at home and just closely monitoring their symptoms. People who become symptomatic, we have instructions on how to limit contact with other people in the home.
So if you are not that person who traveled, but you're in a home with someone who has, what should you do in terms of going to work?
Yeah, we wouldn't have any restrictions on those individuals. If that person became ill and tested positive, then that person would be a close contact and now required to self-isolate.
What numbers will you have to see or indicators will you be looking for down the road to see if it's safe to open schools again? Like where do we have to be to get back to?
We have epidemiologic methods to look at when, and it's always retrospective, when we peaked and when we see things going down, and then we look at the number of cases within the known incubation period. So we have ways of looking at that. We're obviously going to proceed with the utmost of caution when we start to reverse our social distancing messages.
This seventh case here, you're not saying that it's not travel related, you just don't have enough information yet?
I don't have all the information right now to give you all a specific on that.
Can you elaborate on why this one is taking longer than the other ones?
Yeah, well, a lot of times we know right away because it's written on the lab rec. So when it's reported to me, sometimes I know right away that the person was back from a destination internationally and the date they came back, if whoever tested it wrote it right on the lab rec. Otherwise, if it's not there, we have to dispatch our public health nurse, they work with the local MOH, and then I get that messaging back. So it's a bit of a process.
Any concern with domestic travel still, now that we're seeing kind of states of emergency in BC and more deaths there? I know you're not recommending international, but are you asking people just not to leave Manitoba now?
Well, I think that now is not the time to really be traveling. So certainly, non-essential travel, even domestically, I would be thinking about when we're advising people to, if you can stay home, then it also makes sense if you don't have to travel, then don't travel.
What is your
recommendation for hair salons, massage therapists, other close quarter professional services of a non-emergency nature?
Right, so we have communicated with a number of the professional organizations about the social distancing strategies and giving them information on how to make the informed choices. For others, it's again it's the same messaging about maintaining that distance, screening for people, so nobody who's showing symptoms should be showing up to your place, social distancing in any of the areas.
But you can't cut hair at a distance, so what's your recommendation to them?
Yeah, well, I think that it's a choice they're going to need to make right now on how they can adequately ensure sick individuals aren't walking into their places. Frequent hand washing, limiting waiting in the areas, and and this is evolving all the time. And if we see more and more community transmission, then our messaging can be more clear and more firm on those things right now.
There's a lot of people that are, you're on social media, you're seeing this, you're inundated with all of this stuff all of the time. And there's mixed messages everywhere. I mean, last night there was a former Blue Bomber saying, "Oh, yeah, it's okay to go out and do whatever. I'm going to do what I want, live my life," that sort of thing. But where should people be? Should it just be the province, the Public Health Agency of Canada? Like, is that it? Because there is a lot of messages, and they are so often mixed.
Right. And lots of messaging out there. It sometimes instills fear in people. So yeah, I would be advising them to the Government of Manitoba coronavirus site, first and foremost, looking at these credible information and using it as a resource. It's a tool. Using credible information is one of our biggest tools right now to limit the impact on yourself and the people around you, and even at the province as a whole. So be prepared. Don't be panicked. Use our information. But then really, now is the time for action. We have to change how we live our day-to-day lives now if we want to reduce the impact of this virus.
If my neighbors come back from a trip abroad and I see them out gallivanting around and having people over, is there a snitch line? Is there somebody I should call? What should I do? Should I just publicly shame them, or what's the strategy?
We don't have a line such as that. There is public health that could be contacted, and then this is a time that we all can come together. Maybe they haven't heard the messaging. Maybe the first step is just to politely advise them of the messaging that's out there. These are difficult times. We understand that. So now is not the time to try to separate ourselves. Now is the time to work together. Certainly social distancing, but not social isolation. And we need to look out for each other.
Just to clarify why breast screening is being delayed, or not delayed, postponed, I guess, for 3 weeks?
That was a decision from Cancer Care Manitoba. They are looking at what other jurisdictions are doing, and it's just a temporary measure so they can, I think they're ideally they would be going to ramp it back up again, but I think just to be safe, and there is that close proximity as well when doing mammograms, so that was their decision.
Does that pose a risk at all, 3 weeks? I mean...
Well, I would go onto the Cancer Care website. There are ways to self-check as well, and if there is something that needs to be escalated, anyone could contact Cancer Care Manitoba and get direction if concerns.
So would those workers be directed to helping out with the screening for COVID-19, or what would they?
Yeah, they could be, and certainly as we see certain elective things ramping down, we will be looking at where we can redistribute that staff. So we do think at some point when COVID-19 starts entering into acute care or the resources required to monitor, we will keep an eye on our human resources and what kind of support we need where the biggest priorities are.
Dr. Roussin, you said none of the 15 are hospitalized. Did any of them ever require hospitalization?
No, I have no reports of any hospitalization of these cases.
Do you know what's happening with the $35.2 million worth of supplies and personal protective equipment that Manitoba was trying to buy with the other provinces?
I mean, that order has been placed, and we're actively following up on when we should expect shipment.
Anything else? Thank you once again for answering all these questions every day.
Yeah.
Thank you.
very much.
When do you get a day off?
That will be at the end of the pandemic.
Okay.